Do you know germophobia is a thing? We all used to sort of make fun of people who would wipe down every surface and, you know, they were a little bit over the top. I mean, it's good to be clean and hygienic. Cleanliness is next to godliness. But this whole pandemic panic has turned into a psychological disorder, according to a column by our next guest, John Carpay, the executive director of the Justice Center for Constitutional Freedoms. Germophobia is actually a medical condition itself. John, great to see you. Welcome to our world headquarters here in Toronto.
Good to see you, Ezra.
I was reading your essay, and I didn't think about it this way, but we used to sort of make fun of if it was a light case of germophobia, but that's actually a medical condition, and some people could be actually crazy about it. They would be afraid to go out of their homes. They would
not use a public bathroom.
Yeah,
wipe down a chair before you sit on it. You remember Niles Crane, the character on the Frasier series? Frasier was that popular sitcom with a talk show psychiatrist, radio psychiatrist. Yeah. And so he had a younger brother, Niles Crane, was always wiping everything down and always didn't want to touch anybody, didn't want to shake hands. And it under the DM5, it is a recognized psychiatric illness, germophobia.
Yeah, I mean, it's always good to be somewhat afraid of germs. Our gag reflex, I think, is an instinctive reaction, a rejection to things that are rotten. Don't eat that maggot-covered meat. That makes you want to throw up. That's your body's way of saying, we've been practicing eating strange things for 100,000 years. Don't eat that. So it's good to be germophobic. It's good to wash hands. Washing hands and penicillin and antibiotics, those are great developments. But to be so terrified of the world that you're like the boy in the bubble, that is a mental condition. And I think it has been inflicted on millions of people who are genuinely afraid to leave their homes. I think that there are people, especially seniors, who have been terrified by this, who will never leave their homes again. And I don't mean ever, ever. They'll go and get the groceries. They'll go and get the mail, maybe. But they're never going to go to a restaurant, a theater. They're never going to go to a family reunion. They'll never travel again, never go on a vacation. They're just going to sit in their homes until they die as a form of mass germophobia.
It's very sad, the fear that we have been put into as a society with the politicians basically running with the Neil Ferguson Imperial College predictions from March that millions of people around the world would die. And this Neil Ferguson, he's been spectacularly wrong on BSE, mad cow disease, the bird flu. Every pandemic he is out by thousands of percentage points, and yet people were still listening to him.
The irony is, I mean, I remember reading headlines about his study. Obviously, I didn't go deep into it. And I thought, oh, this is cause for concern. I myself propagated, I mean, Imperial College sounds very authoritative. It was a pack of lies. The thing about him is that not only did he produce the seminal propaganda document that everyone followed, but even he didn't believe it in his own life. He's the one who broke the lockdown rules and ran around town sleeping with his married mistress, breaking the rules. And I mention that only because, I mean, not that I think that's relevant to his science, but it's relevant to the fact that even he obviously doesn't believe what he's saying. If he's arranging trysts, illicit trysts when we're all supposed to be in lockdown, he didn't believe it himself, but he loves seeing other people dance to his tunes.
He also recanted in part, and this got very little publicity, but he did speak publicly before a parliamentary committee a few weeks later, and he said his numbers were way out, and he also said most of these people would have died anyway, making a reference to the fact that the COVID is a deadly killer for people that are in their 80s. They're already very sick with cancer or emphysema or heart disease or diabetes or any number of things. And so Neil Ferguson had said these people would have died anyway, and his numbers were out. But by then the panic train had left the station.
Oh yeah, and people didn't want to hear him.
And people didn't want it, but he did retract it. And what's so sad now though is I feel kind of conned and tricked, because I didn't oppose these lockdowns in March. I thought, well, if there's millions of people who are going to die, we should take some decisive action. But now we're into October. We're 6 months, 7 months past. We know, looking at government data, I'm not talking about getting data off of some right-wing conspiracy website or something. Government data, Ontario government, Alberta government, Italian government, Center for Disease Control in the US, government data tells us that this is not an unusually deadly killer. And the death numbers are closer to an annual flu than to a real pandemic like the 1968, 1957, 1918.
Yeah. I've seen stats now in the United Kingdom that more people are dying from the regular flu than from this virus. And look at this just for a second. These are statistics from the government of Ontario. This is their latest modeling. They just rolled this out days ago. You can see they have their best case scenario, middle case, and worst case scenario. Already, the facts are better than their best case scenario. So we see already that their modeling is still way, way, way off, and they're still proceeding with their crazy lockdowns.
Oh, these models have been discredited entirely, and yet they continue to form the basis for public policy. In Alberta, Premier Hinshaw and her lovely assistant Jason predicted back in April that there would be 32,000 deaths, even with lockdown measures in place. 32,000 Albertans would die. Do they know that in Alberta there are 27,000 people that die every year from all causes, cancer, heart disease, everything? It's 27,000 people die every year. COVID deaths are at 250 compared to 27,000.
Yeah, and
they predicted 32,000 people would die.
So it was more. It was less than 1% of what they thought. I know that Justin Trudeau and Theresa Tam predicted up to 350,000 deaths. The number is about 9,200.
9,200. And the total annual deaths in Canada from all causes, right? Cancer, suicide, car accidents, everything. Total annual deaths in Canada is 275,000.
Yeah. I learned something from one of your papers on Saskatchewan. You were quoting the public health officer. I didn't know there were so many public health officers in this country. Every province, every city, every region. And these folks are making $200,000, $300,000, $400,000 a year. There's probably 100 of them in Canada. And they all just repeat the talking points from the World Health Organization. I don't even know why we have 100 of them. They're just sort of repeating what the lead mouthpiece says. It's very strange to me. He said in Saskatchewan that the virus doesn't discriminate.
Yeah,
young,
that's right.
old, male, female, any race. But that's actually not true. As you indicated, I mean, I've studied the numbers in various jurisdictions. The average age of death is between 83 and 86, depending which province you're at in this country, which is, by the way, older than life expectancy in Canada. And I'm not happy that anyone is dying at 83, 80, 45.
But we have to look at reality.
Well, but just don't say that this virus doesn't discriminate. The virus does discriminate, and that's useful information. That means you don't have to shut down summer camps for kids, schools for kids, restaurants where waiters and waitresses are in their teens and 20s. I want to throw something at you. I've been puzzling over Quebec. Quebec has about 23, 24% of the population, but they have a majority of the cases and a huge majority of the deaths. Why is that? Do they not have good hospitals? The answer is most of them are in seniors' homes. Okay, but there's seniors' homes in Ontario. Now, it's true 82% of the deaths have been in seniors' homes. So and
that's across Canada.
So it's not actually a disease that targets the elderly.
It does not.
It targets the elderly in seniors' homes. And Quebec, especially in the last year, has been the most pro-assisted dying, euthanasia, do not revive jurisdiction in Canada. They're obsessed with it. My theory, and I don't yet have the proof in hand other than what makes Quebec different than Ontario, their obsession with do not revive, euthanasia. And so my theory, not yet proven, but something I want to look into, is that these are folks that kids or grandkids said, Gramps, we're going to send you to the home and, doctor, do not revive him. And the doctor says, okay, we won't. And the healthcare system happy not to expend $20,000, $30,000, $40,000, $50,000 in the last month of life. So it is, and the same thing in New York State with Governor Cuomo. They thought, oh, you know what? We got people who are in their 80s, 90s, and 100s. They're not going to be around for much longer. I'm trying to get into the mind of a Cuomo or a Legault. And they're saying, well, and the kids don't want to spend money keeping them around. Just put them all in these seniors' homes and put them on the ice floe and sail them out to sea. That's a terrifying and terrible speculation. But that is the law in Quebec more than anywhere else in Canada. It is a pro-assisted dying jurisdiction. There's no two ways about it. I think that that's what happened in Quebec.
Well, whether that's intentional or unintentional, the one thing that's certain is that the cruelty that has been inflicted on people in nursing homes is astounding. The Justice Centres commenced a court action in Ontario for 2 women, each of whom was not allowed to see their own mother. And this has been repeated across the country thousands, tens of thousands of times. People cannot go in to provide the love and attention and care and affection and just practical help with feeding and dressing and so on. The family members are prevented from taking care of the seniors because they depend, many of them, on their kids and grandkids coming in to help out, and they've closed it off. And at the same time, but the staff are allowed in, right? But the family visitors are not.
So that's the opposite case of what I'm talking about. I'm talking about cases where everyone's happy to let Granny go out on the ice.
Well, you probably have both sides.
Yeah,
side.
This is
You have loving family members,
Yeah.
and you probably also have some callous people that maybe want their relative to die as soon as possible.
I was on the phone today with someone from the United Kingdom who works in seniors' homes and says that the chief worry for them is actually malnutrition and loneliness. You've got these people in their 80s who, I was surprised to hear malnutrition is a concern, but it is a fact that the deaths are so low now in Canada, even though the cases are high, that suicides are higher, opioid deaths.
Child suicide rates are going up.
And
horrible.
I detected something in Toronto. We're following up on it. I used to go to the Toronto statistics page every day because it was actually there's a lot of statistics there, and I started to notice that no one died in the entire month of September. I think until like I think there was like 1 death
of corona. You're talking about.
Yeah.
Okay. Yeah.
In the whole, and I thought, wow, and I think there was only like 2 or 3 in August. That's very, very, very low.
But the wave has come and gone. I mean, the deaths peaked in March, April, May.
Yeah, April.
And they
April,
came down, and then May, June, July, August, they come down.
So every day, I do a live stream every day at noon. So every day I would go to the page, and Justin, our producer, would call up that stat, and we would say, okay, there was 0 deaths today or 2 deaths or whatever. And we would go to the stats, and we would ignore the stats that are there just to wow you. This many people had cases. And then suddenly we went to that website and it was gone. Well, the website's still there, but those easy to find stats of when people died and how often that was just gone. And now you can get the raw data, but it's not in chart form, and you have to be a whiz at data manipulation. This is news I haven't mentioned before. So we put in an access to information request to the city saying, how come you've changed, like this website was the same for 6 months.
The city or the province?
City of Toronto.
Okay.
This website was the same for 6 months. Why did you suddenly change it to make it hard to understand? Like for 6 months it worked just fine. And they wrote back and said, instead of giving you an access to information that shows, can we just give you an explanation? And it's, we think there was too much clutter there. And we wrote back and said, no, actually we don't want your explanation. Can you give us the background documents that shows what you really, and they're fighting with us. And now they're saying, because of the pandemic, we can't show you the emails. I think, and again, I'm sounding like a bit of a conspiracy theorist here, but why is it that after 6 months they changed how they show the data, and when we ask for the documents, which is our right under the Access to Information Law, they say, no, you don't want to see it. Can we just give you a verbal explanation? You really insist on seeing it? We're too busy because of the virus. I think that the Occam's razor, the simplest explanation is they actually don't want people to see that we're pretty much in the clear and that we don't need to panic. And bringing in all these mask bylaws in August and September was about 6 months too late.
And a shutdown in Quebec in October. These devastated, crippled restaurants and bars and pubs and other places, and now for effective October 1st, the lockdowns are back in Greater Montreal, and it's some of these businesses, they're on the verge of death.
And Montreal used to have such a wonderful restaurant scene. I just read the story yesterday in Montreal. Not a single outbreak was traced to the restaurant industry. So why are you shutting down the restaurant industry? Not a single outbreak. Why are you punishing them?
And there are no deaths. So I don't know what's going on, but I can tell you whatever's going on is very, very bad, because the lockdown harms are, they're killing people, even worse in the third world, but bad enough in Canada. We got canceled surgeries, people not getting their cancer diagnosis, people driven into unemployment and poverty and despair and suicide. We've got opioid deaths, twice as many people in Alberta and British Columbia for sure, and probably in other provinces, twice as many people dying from opioid overdoses than from coronavirus. Mm-hmm. And those numbers are way up over last year. Why is that? Well, despair. Yeah. You get unemployment, and you destroy livelihoods.
And then add in quick cash from Justin Trudeau.
And quick cash and unemployment. So the whole thing is, these policies are causing way more damage as compared to any lives that may have been saved, and I have yet to see the evidence on that.
That's an excerpt from my daily show, The Ezra Levant Show. Every day I do a monologue on the news of the day, then I interview an interesting guest, and then I read my hate mail. You gotta subscribe. Go to rebelnews.com.